Welcome to Hormones Simplified. Today's topic is ovarian reserve testing. Many of you must have heard about OORT or ovarian reserve testing. It's often covered in media. There are many women who are asked to have these tests when they go to gynecology or fertility clinics. I'm going to talk a little bit about ovarian reserve testing and what are the four main tests that are used in most clinics in the UK and elsewhere in the world. So ovarian reserve testing basically means trying to test the quantity of eggs in the ovary. It's testing the reserve that's in the ovary. As we know that women are born with a set number of eggs and women use eggs as they grow old. From early 15, 20 years until they get to 40, usually over the span of 25, 30 years, the eggs in the ovary will be progressively used up and a smaller and smaller number will remain in the ovaries as the woman grows old. So the ovarian reserve testing is trying to find out what the reserve is, how many eggs there are, so that you can make decisions about future fertility or decide which fertility treatment might be the most useful for you. There are four tests which are often used. One is a blood test for a hormone called Antimullerian hormone, AMH. Second is a pelvic scan to look for the number of follicles which are seen on the surface of the ovary. That's called as antral follicle count. Third is a hormone test again, which is a blood test for hormone called FSH, follicle stimulating hormone. And of course, the final one is usually an invasive test, which is when a woman undergoes stimulation of her ovaries. That's called as ovarian stimulation testing. So we look at the first three, which are the common tests, and we'll talk a little bit about the last one later. Looking at the hormone AMH, anti-Mullerian hormone, this is a hormone which is usually produced, or in fact, it's only produced by eggs in the ovary. And that's why it's one of the best markers of ovarian reserve or the store of eggs. So more the eggs in the ovary, more the AMH hormone will be produced, and therefore higher will be the level of AMH. Testing for AMH therefore means we will know the number of eggs because there have been ranges calculated for each age group where the AMH should be. And so if your AMH is within a range that would be expected for your age, that generally means a normal AMH result and a normal ovarian reserve. If it's falling below certain levels, then it's borderline. If it's below the lower part of the range, then it basically means it's low AMH or a low ovarian reserve. AMH or anti-Mullerian hormone test result often tends to be high for women with polycystic ovary syndrome. The next one is antral follicle count. Antral follicle count is usually a scan which is done in the beginning of the menstrual cycle. It's an internal pelvic scan, and generally what happens is the number of follicles or eggs which are on the surface of the ovary in that particular cycle will be counted. Now the count includes addition of both ovaries, and so therefore the number that you get from that is called as a follicle count. These antral follicles measure somewhere between 2 to 10 millimeters, and that's the measurement that we're looking for. So if you combine all the follicles that you see on the ovaries, then that follicle count again can be useful to know how many eggs there are inside the ovary. So the more the eggs on the surface, more the follicles you count, it means there are more follicles or eggs in the ovary inside, the microscopic ones, which you cannot see. Again, there have been normal ranges which have been calculated as per the woman's age, and often doing the count will give you an idea about how good the ovarian reserve is. The final hormone is FSH. This is less reliable than the AMH or the antral follicle count. Follicle stimulating hormone is produced by the brain, and its function is to stimulate the ovary to produce the egg and develop the egg so that it gets ready for ovulation. In the process, the developing egg will produce estrogen. So follicle stimulating hormone will often be low or normal if things are ticking along nicely and the brain is able to stimulate the ovary, the production of egg very easily. If the brain finds that it's getting difficult to stimulate the ovary because the number of eggs is decreasing, it tries to increase the production of FSH so as to stimulate the ovary harder and harder. So the FSH levels will creep up, and that's when you find that if the FSH levels are high, it indicates that things are not right. And basically the brain is struggling to stimulate ovary, and that would be an indication that the level of eggs is declining. Generally accepted levels of FSH is somewhere less than 8.5. As soon as the FSH creeps up more than 8.5, you're thinking that maybe the egg store is declining. The best time to do blood tests or scan for assessing ovarian reserve is between day 2 to 6 of the cycle. It's usually the first week following the period when there is little interference from the ovarian egg growth. And so therefore it would be the best time before the ovary starts developing another egg to assess what the actual ovarian reserve is. The final test of ovarian reserve is putting the woman through stimulation. So you can stimulate ovaries with medication to see how ovaries respond, how many eggs can we grow. This usually happens as part of treatment or as part of IVF treatment, and generally that's the gold standard test. So if you cannot rely on the blood tests or the scans and there is conflicting data or conflicting results, often stimulating ovary to see how many eggs can be stimulated is usually a final test or a gold standard. And this would usually be part of fertility or IVF treatment. Most decisions about fertility treatment or fertility are often done based on the AMH, the FSH, and the follicle count. And you look at all three together rather than individual tests to make the final conclusion about ovarian reserve. One important thing to remember is that the AMH or Antimullerian hormone test is sometimes abused or overused to assess someone's fertility. The AMH test is useful, but it's only useful really to know how many eggs or follicles would develop as part of IVF treatment if somebody was to stimulate a woman's ovary. What it cannot tell you is the chance of natural conception. So women could have very low AMH, close to 0, 1, or 2, and they would still fall pregnant naturally or can achieve natural conception. And it happens in clinical practice all the time. What it will only tell you is that if the woman was offered IVF for fertility treatment, she would grow a smaller number of eggs than would be expected because of the low number of the AMH. So it predicts your treatment response to follicle stimulation, ovarian stimulation, but it does not predict natural pregnancy. So that's the key thing to know, is that it's not a marker for natural fertility. It can only tell you the egg store and how well a woman will respond to stimulation treatment. I hope you found this video useful. If you have any specific questions, do get in touch with us. Until then, goodbye.